You're listening to Aging Uncensored.
Okay, welcome. Welcome back to Aging Uncensored, the podcast where we fearlessly dive into everything aging, caregiving, loving, maybe not loving. Actually, we are going to love. This is the month of love. It's February, right? That's right. And we are so excited about our special guest today. Oh yeah, that's right. Everybody throw up their hearts. I love it, Jody. Yes. So very important. We talk a lot about our brain. And before I dive into everything, we're so excited about what February has to come. And of course, some of us hopefully have stayed on our New Year's resolutions. And when we talked about how we can all fail on those, maybe we can do better this year. But one thing that we always hear, and I've got my co-hosts today, Nicole Crawford, Shaylee Lawson, y'all know them. Taylor, our production managers in the background. And so one thing that we always talk about when we talk about brain health is we talk about heart health. So who better to have on our February 14th, Day of Love. Valentine is what we're looking at right now of our lovely ladies and friends here. So without further ado, Shaylee, please introduce us to who is our special guest today that's going to talk about everything heart healthy.
Yeah, we feel so lucky to have Jody Gilchrist with us. She is a cardiology nurse practitioner, and I have had the pleasure of knowing Jody for several years now, and met her through my time at UAB. And there were many busy clinics where I paged Jody and said, "OMG, please help." Especially, please look at this EKG, Jody. I don't know what to do. Help me. And Jody is a wealth of knowledge. We are so lucky to have her in our presence today. And even beside that, Jody is just a wonderful person, an absolute delight to work with. She is a member of the board of directors at the South Highland Adult Day Center. She has a special place in her heart for those with memory disorders and older adults. And Jody's just all around a great person. So, really excited to have her here today to chat about heart health.
Absolutely. And, as I'm sitting here, I'm just like, flashbacks of all the times. Not only, Shaylee, were you a provider, a clinician for my dad, Jody was a clinician for my dad. So Jody, like Shaylee and all of us, we go way back. Shaylee, Jody and I shared several different clients, patients, some with many fun stories, but one in particular, my dad. And one thing that I think is so unique, as Shaylee, what you said, obviously, Jody, you have a passion for working with people with brain changes and as they're aging. Obviously, the cardiovascular population is probably primarily an older patient population for the most part. I mean, obviously, we do have plenty of young folks. I have a niece actually who developed a heart condition at the age, 6 days old, but most of them are, cardiovascular, or geriatric related. But one thing that I think we're going to connect as we talk today, and one thing that I think Nicole and I have tried to connect throughout all of our podcasts is it's not a system or a symptom specific. We're not just looking at the ears or the heart or the brain. So much in medicine has gotten so siloed, but what I think is unique, particularly about you two ladies, and actually all of us today on the Zoom, is we look at the whole person. And one thing that Jody did is she ran some labs when my dad was there, and she ran some labs, and she found a marker that typically someone in cardiovascular services wouldn't kind of think was out of the ordinary. But she actually sent it to my dad's primary care physician, Dr. Grammis. Dr. Grammis noticed that that was a different marker. Long story longer, that's what led to dad's diagnosis of gallbladder cancer. So it was kind of looking at the big picture of things and knowing the patient and knowing that this is a little different. And wow, somebody in the cardiovascular clinic reached out to the primary care physician, and lo and behold, we got to where we were with him. So I think that that's been something that obviously you two have lived and focused on your practice. So I think with that said, we can kind of start off with, obviously it's not just about the heart. So what are some of the things that you feel like you've put into your practice when you're meeting your patients? Kind of thinking outside the box that way. Up to you, Jody. Sorry.
Oh, okay. Sorry. Well, certainly, whenever I'm seeing a patient, I definitely try to look at the big picture. I like to know, what they're eating, what they're doing activity wise. Honestly, my lead in question typically is, so what have you been doing for exercise? And then if they say, a lot of times somebody will say, well, I don't exercise at all. And then I'm like, well, are you still working? And, maybe they work in construction or, today I had somebody that's the quality control person at Milo's Tea, so he's on his feet, so a lot of times people are doing active things in their jobs that maybe they don't consider exercise, or they're like my parents. Well, they actually do a lot of exercise now, but, my dad is just still, even though he's 80, he's super active still, getting on the roof and blowing leaves off and that sort of thing. That's why he has to have an Apple Watch. But so a lot of times people they're not going to the gym, but they're still active. Because anything typically concerning for the heart, the symptoms usually present when a person's exerting themselves. So knowing what they do for a living, knowing, kind of what their baseline activity level is, gives us a lot of clues.
Absolutely. Absolutely. Sorry, I threw the little opener question to you without any warning there.
Oh, no, that's okay.
We tend to do that, right? All right, Shaylee, you've got several questions I know that are brewing. So I'm gonna turn it over to you.
Yeah. So Jody, stating like heart disease is such a broad statement. And as a clinician, I'm certainly not a cardiology specific clinician, but I sort of place heart disease into buckets in my brain. I think about, arrhythmias and kind of electrophysiology issues. I think about vascular issues and kind of, coronary things, structural issues and valvular things. And I think that at the end of the day, each of those buckets can affect our brain health. I mean, if you put
absolutely. Wow.
Put it very simply, like your heart pumps blood and your brain needs blood to do the things it does. I have to just take it down to such a simple level. I think probably what people are most familiar with, and especially in the Southeast where we live, is probably more like vessel disease. I mean, all of these things affect all of the people that we serve. But talk to me about kind of vessel disease, coronary artery disease, and what does that mean? Who is affected by that? And how do we modify that?
Okay. So, vascular disease, so the term we use now is atherosclerosis, which our parents call it hardening of the arteries. The same process, and basically, that process is where cholesterol gets laid down in the coronary artery. And there are certain types of cholesterol that tend to do that more, one being LDL, which is your low density lipoproteins. And because they are the smaller particles, they can fit more easily into the vessels to cause plaque. And there are risk factors for that. One risk factor, that we can't change. We talk about modifiable risk factors and non-modifiable risk factors, and certainly your genes are your genes. That you're born with your genes, and you're born with a set of cards that you want to play the best you can. But certainly, people that have genetic predisposition for atherosclerosis, they develop fatty streaks in their arteries even as teenagers. And then, certainly things like smoking, being obese, having high blood pressure, diabetes, high cholesterol, those are all things that add on top of that. We do know now, as far as when we're talking about cholesterol, that only 10% of your cholesterol comes from your diet. So the other 90% is genetically determined and how much cholesterol your liver manufactures. So, even though somebody has high cholesterol, it doesn't necessarily mean that they have a poor diet. I see people all the time that are basically starving themselves, because they're trying to get their cholesterol down naturally. And, I just have to say, hey, this isn't your fault. You didn't do this. There's not anything you're doing to cause this. This is, just your genes. And I was really, really happy one of the times that I listened to Dr. Gelmacher, because he addressed the number one medicine we have to treat cholesterol is called a statin. And a lot of people are afraid to take statins. And one of the reasons that they're afraid to take them is because they think they may cause dementia or Alzheimer's or memory problems. And I was so happy that Dr. Gelmacher addressed that issue 3 different times during his hour-long talk. And I was just like, oh my gosh, this is like the best day of my life. And it's been wonderful to be able to point back, because everybody, not just in Birmingham, but most people know who he is. So when you say Dr. Gelmacher, the director of the memory clinic at UAB is actually a statin proponent, and feels like people have, less dementia and, less risk of, losing their memory when they take their statin. That's really, super helpful to have his support on that.
It's nice to debunk that myth.
Yeah,
right?
yeah. And then other reasons people don't want to take a statin is because they're afraid of muscle pain. And actually, they did a study where they compared placebos to statins, and the same number of people complained of muscle problems that were getting placebo is the same number that did get the statin. So really, there's been a lot of research on the things that cause people not to take statins as well. And then another risk factor is blood sugar. And again, you can have some genetic predisposition, but diabetes is heavily affected by your diet and your activity level. And now, we know about insulin resistance. And one of the other things that Dr. Gelmacher talked about, as far as with the, insulin resistance and so forth, is he was talking about how, our ancestors, they did not eat after dinner. When you had your dinner at your evening meal at night, you didn't eat anything until the next morning, and that was why it was called breakfast. And so
You're
now
breaking the fast.
You're breaking the fast, and now we tend to eat around the clock, and our pancreas is constantly releasing insulin, and our cells just become immune to it. And so a lot of times people develop diabetes not because their pancreas is working fine. It's just their cells have become immune to their insulin because they are because we constantly eat, and so we're constantly having insulin released. So that's a factor. And then of course blood pressure. Your weight, for every 2 pounds you lose or gain, it affects your blood pressure a point. So the heavier you are, the higher your blood pressure is going to be. And then salt in the diet is the thing that affects your blood pressure the most. And of course, blood pressure greatly affects your brain. All these things do, but that one in particular. And then, of course, tobacco use. Tobacco use is a huge risk factor and certainly a modifiable risk factor. Definitely, don't want to smoke. And some people they've just already made up their mind that they're not going to quit smoking. Particularly, sometimes I see older patients that say, I'm already in my 80s and, I just enjoy smoking so much that I just don't want to give it up. It is important to know that, yes, we definitely want you to stop smoking. However, smoking less is better than smoking more. So even you reducing the amount you smoke certainly helps.
And
Are
Jody,
y'all seeing
you
issues
told
with I'm sorry, Jaylee, are y'all
Oh,
seeing
it's a-
issues with like vaping and
Oh
cardiovascular
gosh.
health?
Well, we just don't even know what all the vaping causes.
Yeah.
We know it's bad. It's so easy, even my daughter.
People are like doing it inside and just like in
Yeah,
public spaces around everybody.
I walk into exam rooms sometimes and I've seen people have it hanging around their neck.
Oh, God.
And and I think it's almost like cell phones, how people have gotten so used to not being able to have a conversation. And so I think it's almost kind of like a cell phone where, like you can look down and do it. And I think the vape is almost like, well, if I have this in my mouth, I'm not expected to respond or, or say anything. So I think it's, kind of falls in that same category. We just don't even know, all the things that it's causing.
And Jody, you talked about some of the vices. So sugar, salt, smoking. What about alcohol and all of that?
Alcohol is, coming out. They keep finding more. We used to say, drink red wine. It's great for you. And now we say, if you don't drink, don't start. If you do drink, limited to 2 servings a day, and that would be, 2 ounces. A serving would be 2 ounces of liquor, 4 ounces of wine, or 1 can of beer.
So like the big fishbowl margarita, I can't have 2 of those.
No.
Or
And
the
you can't
whole
save it up.
bottle
And you
wine
can't save it
glass.
up. You can't save it up either. I have to always say that. So
You
you
mean I
can't
can't wait until the weekend and have
Jody.
8?
and do all 14. Yeah,
And
you can't have your 14
I
servings
thought you could
all
save
at one
it.
time. I
I thought
know.
it was like those Weight Watchers points where you
Yeah,
can
where you can
save
just
them up.
use them
Or
when you
rollover
want it.
minutes or something.
Right.
Oh, man.
But now they actually, so there's a huge link between alcohol and atrial fibrillation.
Oh.
And then, of course, atrial fibrillation causes stroke. So particularly, important in our area, that we're so interested in as far as, heart health and brain health. So now any amount of alcohol, is felt to be a big, one of the 3. So the 3 main risk factors for AFib are alcohol, sleep apnea, and obesity or a sedentary lifestyle. Now, we're really backing off, on the whole, alcohol, where we used to say, 2 servings a day is fine. We're kind of cutting back, on that and really saying, well, if you, can just not have any at all, it's probably better for you, particularly if you already have atrial fibrillation or you're at risk for atrial fibrillation.
I'm glad you brought up AFib. So atrial fibrillation, atrial flutter, let's talk about those. So one thing, my dad's like the perfect poster example of all health issues. So he was going in for a knee replacement, and I was with him during a pre-op meeting with the surgical nurse. Surgical nurse is asking him about his health and cardiovascular health. And he's like, oh, my heart's fine. I take some blood pressure medicine. I'm like, Dad, you have AFib. Oh, no, I don't. I was like, yeah, you do. Like, you went to the emergency room like 5 years ago with AFib. Yeah, but it was one time. And the nurse is like, big eyes. And it's kind of like once you've had it, it kind of hangs around, right? We might manage it and stuff, but talk to us about AFib, A-flutter. You were talking about the 3 things that can cause it. Let's dive into those. And I feel like people should really take note of it. Like if you're being diagnosed with one of these, we need to talk about it. And what does this look like? And how do we manage it? And take it a little more serious than, I'm all right.
Yeah, so atrial fibrillation is a big deal. You definitely, if you have atrial fibrillation, even if you had one episode, you want to be followed by a cardiologist because as long as the heart rate isn't elevated, most people are not aware that they're having atrial fibrillation. So when you're having atrial fibrillation, so normally, and I have to use my hands to describe it, but normally the top of the heart beats and the bottom beats, top beats, bottom beats. But when you're in atrial fibrillation, the top of the heart is just quivering, and then the bottom of the heart beats normally. And so the risk of that is, I mean, there's a couple of different things. The first thing is because the heart's just quivering and not squeezing, a clot can form, and then that can get pumped to the brain and cause a stroke. The other thing is because the heart's not squeezing, you get 30% less blood flow with every heartbeat. So it can make you feel lightheaded. It can make make you feel short of breath, and cause chest pain. So it can cause those symptoms as well, swelling, those symptoms as well. So there's a formula that we use called the CHADS 2 VAS score, and each one of those letters is a different risk factor for stroke. So depending on how high you are, how many points you have, it determines on whether or not you should be on blood thinner. But the thing with atrial fibrillation is there's different types, but some people have what's called paroxysmal atrial fibrillation that comes and goes. But if their risk for a stroke is twofold or higher than that we determined from that scoring system from the general population, then they need to be on blood thinner all the time, not just when they think they're in AFib, because you can have AFib while you're sleeping. You can have it at times when you wouldn't be aware of it, when you wouldn't be symptomatic. And again, some people are not symptomatic at all.
My dad wasn't.
A lot of times people go to have, just a routine surgery and the EKG shows they're in AFib. Or unfortunately, my sister-in-law's father, had a stroke, and that's how they determined he had AFib. So we actually, the clinic I work in, we see all the patients back that have had strokes where they didn't find the cause of it, and they send them out with a heart monitor, and then we get the monitor results and see them back, and a large percent of the time, the atrial fibrillation is what's responsible. And we don't see it. We didn't see it when they were in the emergency room. We didn't see it the whole time they were in the hospital. And then they go out with a monitor for 2 weeks, and they're having it and didn't even know it.
Yeah. What about a flutter? Talk to us about that.
So atrial flutter is in the same family as atrial fibrillation, but it's a little bit different. With atrial fibrillation, it comes from an area in the left side of the heart around the pulmonary veins, and it's very disorganized. There's multiple areas that are sending out electrical signals. And then with atrial flutter, it's more organized, and it's a cycle. So it's a circuit. It's like a dog chasing its tail, and where the signal goes around in a circle and around in a circle and around in a circle. So a lot of times people are actually more symptomatic with the atrial flutter. But the problem with the atrial flutter is that the heart rate most of the time stays regular. It's not irregular like the atrial fibrillation. So a lot of times it's not diagnosed as quickly because if somebody just listens with their stethoscope, they're not going to hear an irregular rhythm.
So how does someone find out they have atrial flutter?
So atrial flutter, I mean, most of the time when we find atrial flutter, it's because somebody's short of breath. They're short of breath, or they're feeling lightheaded, or, they're having swelling, or those sorts of things, or again, they have a TIA or stroke.
So can a flutter like AFib, can it cause a stroke?
It can, yeah. So it can also cause strokes as well. Yeah. So people that have atrial flutter, if their score is high enough, have to take blood thinner as well.
Okay. So you use that same CHADS for a flutter as you do?
Yeah, I use the same scoring system for both.
How common is it, or how likely is it for those two to kind of merge together and you end up having both?
A lot of people have both. Yeah, a lot of people will have both. Sometimes people will have like an atrial flutter ablation because atrial flutters more easily ablated than atrial fibrillation. And a lot of times they'll have an atrial flutter ablation and then end up having atrial fibrillation as well.
And the piece about the blood thinner aspect of it is that that's always a very individualized. I mean, the CHADS the CHADS VAS score is a tool to kind of guide you. Is that right, Jody? But there are going to be some people who may have reasons that they cannot be anticoagulated.
Oh, absolutely. Yeah. So there's also a score called a Has blood score. And so, certainly if the Has blood score is higher than the CHADS VAS score, then that might not be an appropriate patient to be anticoagulated. There is something now called a Watchman device that we sometimes offer patients. It's rare that we just don't anticoagulate at all. Unless it's an older patient and they just choose not to. It's just, a bleed we can usually treat, whereas, a stroke, is often, a stroke often doesn't kill you, but it completely debilitates you. So it's very rare, that we either don't anticoagulate or, offer the Watchman, something like that.
Could you talk just very briefly maybe on the different types of blood thinners and how they're all different?
Sure. So as far as anticoagulants that we would use for atrial fibrillation, there are only three. There's one called, well, no, there's four, sorry. So there's an old one called warfarin. And we don't really like to use that very, very often because it's very labile. It's not very consistent, and patients have to follow a very steady diet. And almost all medications that you take interact with the warfarin, so they can affect, how thin your blood is. And also, you have to monitor your INR, which while you're on it. So that's the oldest blood thinner that we have.
AKA Coumadin for folks.
Yeah, Coumadin. Coumadin. And that one works by blocking vitamin K synthesis. So, like when your babies are born, they give them a shot of vitamin K so that they can start clotting their blood. So this basically, blocks vitamin K so that you don't clot your blood. That's how it works. It's rat poison. Yeah, it's the same thing. It's just in a tablet. But there are some people that's the only option for them, because if a patient has a mechanical heart valve, that's the only blood thinner that's approved for patients that have a mechanical heart valve. And then sometimes patients choose to be on it because it's cheap, but it's not preferred. It is, definitely, not preferred. And then we have
on warfarin, it's because the therapeutic levels can be labile. There may be time, you can put yourself at risk if you're not in therapeutic range. If you're under or you're over, it's just very risky. It can be.
Yeah. And the risk for the risk for mismanagement or non-med compliance is very great.
Oh yeah, it's huge. And then so another one we have is called Eliquis, and it's a twice a day blood thinner. And then we have one called Xarelto, which is a once a day blood thinner. And then there's one called Pradaxa that is now generic. That's a twice a day blood thinner.
Is that Plavix?
Well, Plavix is in a different category.
Okay.
So aspirin and Plavix do not prevent the type strokes that you have from atrial fibrillation. So they don't prevent embolic strokes. So aspirin and Plavix are used for ischemic strokes, which the strokes from AFib are embolic strokes, and that's a type of ischemic stroke. But the ischemic strokes that are not embolic, that are, from atherosclerosis, aspirin and Plavix are, the blood thinners that we use for that. And Plavix is like a super aspirin. So aspirin and Plavix affect your platelets, whereas all those others that I mentioned affect your clotting factors.
Gotcha. Are there times when both would be prescribed?
Oh, yes. So like if we have a patient that has atrial fibrillation, when they go home after having a stent in their heart, they'll be on aspirin, Plavix, and then, Eliquis or Xarelto for a week. And then we stop the aspirin after a week. And then they're on Plavix and either Eliquis or Xarelto, indefinitely or for at least a year, for the Plavix after a stent. And then usually, the Eliquis or Xarelto indefinitely.
Gotcha. Go back to the Watchman. Talk to us
Okay.
about what that is and what that does.
Okay. So the part of your heart where the clots form is called the left atrial appendage. And it's in the top of the left side of the heart. And so there is something called a Watchman device that they can put in to seal that off, so that you don't have that area. And so it's for people that cannot take blood thinners, either because they've had like a bleed in their brain, or they've had a GI bleed, so they've had like a stomach ulcer that bled, or they fall all the time, or they have some type of bleeding disorder, or platelets are super low, something like that, or also they have an occupational hazard. Like maybe they work on the Mercedes line or the Honda line, or they're a tree surgeon, or, something where they would be at high risk of being hurt. So it's for people like that, that can't take the Eliquis or Xarelto or warfarin. But the only indication for blood thinners that the Watchman is for is atrial fibrillation. So like if you're on blood thinners because you've had a blood clot in your leg or a blood clot in your lung, for some other reason, then the Watchman's not, that wouldn't help. It wouldn't help you. And people that get the Watchman, they do have to be on blood thinners, for a period of time before it and after it. So it's not perfect.
Gotcha. Well, I know we can talk to you forever. And we've got like 15 more minutes. So we're gonna have like a second section. We're gonna have to have Jody like on. I mean, we're like everything that all the great things that Shaylee you put on our agenda. I mean, this really could be like 4 podcasts. See, Jody, when we start talking, it just kind of you don't even know that you've been going for this long. We can keep going where we are, or because we are heart healthy is brain healthy. Let's leave the last 15 minutes, because I want to be a good steward of your time, to talk about the things that you're seeing for like prevention and what you recommend. I mean, we talked a lot about Dr. Geldmacher, and he always says what's brain healthy or what's heart healthy is brain healthy. And he talks about Mediterranean diets. Obviously the first question, which I love that you ask when you see a patient, is what's your activity level, right? What do you do for exercise or for your occupation? So let's dive in. We know we don't need to be smoking cigarettes and drinking, 2 fishbowl of margaritas or a bottle of wine every night. The genes are who we are. We got to wear the genes that were given to us at birth. But tell us about some things that we can all do, the small changes. We talked about salt, but I know in some situations, the healthy salts can be good for people. So, there's all kinds of things coming down the pipeline. What are some great takeaway points that if we want to do the things that we can control about being heart healthy, what are those?
So exercise is super important. And so just 15 minutes of exercise a day reduces mortality by 20%, which is, almost more than any medication, that you could take. So I think a lot of people get locked into, it's dark outside, I can't go for a walk, or, I'm running late, I can't go to the gym. And you think that that you can't do any form of exercise because you've missed this like time window. But actually, just walking 15 minutes a day, is, super, super helpful. So I think it's important, not to just, if you can't go do your hour-long workout, it's important to do something instead of nothing. I've been using an app called Down Dog, which is a yoga app. And you can choose, the time that you want. And I choose the 15-minute and try to do it in the morning and then at night too. But getting some form of exercise in, and I always tell people, try to let your job pay you to exercise. If you can walk at lunch, or you can take the stairs, or if you have instead of like saving up tasks, to go take all of the things you need to shred or all the things you need to fax, like for the end of the day, go do it, every single time, just
You need to start a walking club, an LCS walking club.
And then, certainly, under the desk peddlers, that, or a stand-up desk, one of the walking mats, those are all things, that you can do. So, definitely, activity, is important. Drinking enough water is important. That really the best rule of thumb is simply to drink enough that your urine is very pale to clear, rather than trying to keep up with a certain number of ounces, simply because, the amount of water you need depends on your activity level and the time of the year. So that's a good OSHA guideline that you can use. And then as far as, diet, trying to, like you said, Dr. Gilmacher said, with the Mediterranean style diet, but just trying to eat as many fresh fruits and vegetables as you can. That's super important.
So Jody, what do you do when a patient comes in and they say, "Oh, I'm on the all meat diet. Like all I eat is meat."
Yeah.
So that I can lose all the fat.
Right. So for us, we really don't
That's the
like.
vegetarian.
I
Sorry.
know, exactly.
Yeah. So for us, we really don't like the the Atkins or the carnivore type diets, just because the amount of saturated fat tends to go up. But it's certainly fine, to do, a low carb diet. Certainly, if you want to do meat, and, vegetables, and fruit, as long as you're choosing lean cuts of meat, and eating still plenty of, fruits
How
and
about a hot
vegetables.
dog?
Oh gosh, no, please. Please not that. Please not that. So, and then of course, whole grains, factor in that too. But I mean, I would say honestly, for most people, it's simply the portion size. I mean, it's simply the portion size. So just, reducing portion size, can make a huge difference.
I am the kind of eater that I might not eat for a very long time, but then when I do, I want my belly to feel full when I get done. So reducing portion size for me would be very hard. Well, if I eat too much, then all of a sudden I'm like bloated. So it's like, if I get too
much, I know, or
too
tired.
much,
Yeah,
exactly. But I love what you were saying, that in past times nobody ate after dinner. So this idea of having a midnight snack, or dessert and those kinds of things. It's our family loves a sweet, but it's like, maybe if we're going to do that, do it in moderation and do it during the day. Don't have it at night, and watch when we're eating, right? Like what time of day we're eating and things like that. Then there's the risk of like skipping too many meals, and then you're,
angry.
That's right.
Yeah. I mean, there is some data on intermittent fasting as well. So, I was really happy to hear what Dr. Gilmacher said, though, because I mean, it's kind of funny that we even say intermittent fasting, which honestly, what he's saying, like if you eat dinner at 6 p.m., don't eat breakfast till 6 a.m. That is intermittent fasting. And that's just what you're designed. That was how we were designed, to live. And his explanation was just super interesting, because it was just saying that your body needs that time to purify itself. And he was talking about that's when all the amyloid is laid down in the brain, that if it doesn't have a chance to purify itself, if your body doesn't have enough time to get rid of, all the stuff we put into it all day, that's what causes, incites the inflammatory process, which, is diabetes, coronary disease, cerebrovascular disease. All these diseases, are basically caused from inflammation. So I really have used that advice a lot in my practice.
How about sleep? You talked about sleep apnea being a real contributing factor, a high risk factor for cardiovascular issues, particularly atrial fibrillation. So with sleep, whether it's not treated sleep apnea or you're just not sleeping well because of stress or those kinds of things, how does that play into your heart health?
It definitely, affects your health a lot. The sleep apnea is huge, for a lot of different reasons. For one, if you are depriving your body of oxygen, while you're quote asleep during the night, then, that can cause obesity, it can cause diabetes, it can cause high blood pressure, it can cause atrial fibrillation. So it can lead to a lot of different problems. But then also, if you're not sleeping well at night, then you're fatigued during the day. It's kind of a vicious cycle, because all of our sleep hygiene is focused on getting up at a regular time, not drinking caffeine afternoon, limiting your caffeine to 2 servings a day, but then not drinking any afternoon, and then making sure you get regular exercise, not having screen time for 2 to 3 hours before you go to bed at night. So, yeah, I think all of us do. So not taking naps during the day, but then if you throw sleep apnea into it, then it can make it hard for people to kind of break that cycle, without getting their sleep apnea treated.
And then thinking of our older patients, it's a vicious cycle because maybe there's somebody with brain changes and has dementia. They're kind of getting their clocks out of order. They're sleeping more during the day. Now they're up at night. And now the family is like, or the care partners are like, oh, let's give them a sleep medicine.
Oh yeah. That's not a good thing.
So talk about what that looks like when you're, now you're, I mean, it's just like you said, we're all our systems they're all connected. It's not just heart and brain. It's pancreas, it's liver, it's everything's all connected. And you just chase this tail. We can get into a whole nother podcast. Like Shaylee wanted to talk about the cardiovascular risk with particular medications. But, when you're looking at the sleep hygiene, which I love that you talked about, I know Dr. Duxbury, that was one of the biggest things he talks about. And now Shaylee, you talked about this in the geriatrics clinic, is having a good sleep hygiene routine. Obviously, that's part of this process, exercising, eating right, but you've got to have that good routine, and you can't throw a pill at it.
No, and I will tell you that I think that it's a huge factor in the elderly population. We have patients that come in all the time that talk about how their blood pressure is labile. Their blood pressure goes up and down, and then when I start looking at their lifestyle, they don't get up at the same time every day. They don't eat at the same time every day. Their activity is different every single day, and then they may not sleep at night. And, a lot of these medicines, are protein bound, they require, certain things to, for them to work. And then, if your sleep isn't regular, then you're not taking the medicines at the same time every day, and, and it's really, really a challenge. So I think that the sleep is very important for all of these things. And yes, certainly, definitely do not know, a lot about sleep aids, but I do know, that they, can cause, particularly with like Ambien, people can eat during the night, or do other things that they're not aware of that, certainly aren't good for their health.
We could do a whole podcast on sleep hygiene.
But I was thinking about, but I was just thinking about, like, I hadn't really thought about this before, that's another, good reason to have these adult daycares, because so that, that the elderly people that are, either, possibly home by themselves all day or whatever, so that they do have a routine and have, using their brain and doing physical activity and having
Yeah.
regular meals
Structure
and
yeah.
and so forth, because I'm sure that there probably has been a study, and if there hasn't, then there should be one, saying that they probably have better blood pressure control, better sleep, better, all of these things that we look at.
And you'd be surprised how important, like, just having sunshine on your skin.
Yes, yes.
Huge difference on sleep and happiness and all the things that we're shoving our older adult populations pills for.
Mhm.
Exactly. Some good natural vitamin D,
Right,
right?
exactly,
Natural
exactly.
vitamin D. Well, I want to be a good steward of your time, Jody, and I'm pretty sure if you're willing, we're gonna have you on. I mean, with Shaylee's list, I'm thinking like 3 more podcasts, and I have a list
Okay.
too. Sorry, y'all know what happens. I get talking and I just kind of take over.
We get
My bad.
excited.
I get excited. Shaylee or Nicole, one last question for Jody. Go, Shaylee.
I think what this all kind of ties back to is that anything that's going on with our heart, like, within the blood vessels, or like we can guarantee that there's issues going on with the blood vessels in our brain, like they're connected. It's all connected. And so, all the things that Jody talked about, like, risk modification and treatment, and having conversations with your provider, and advocating if you're a caregiver, all of those things, like heart health and brain health, are certainly tied together. There's no doubt about that.
Absolutely.
Shaylee, we love to have, I mean, not Shaylee, Jody, we love to have fun. So tell me, like, a very funny something that you either happened in clinic or something like that just you think about a lot or tickles you a lot.
I mean, I guess the things that make me laugh the most are, well, my dog. So I told you I've been doing the down dog yoga app.
Yeah.
And so when I'm doing my yoga, she gets down on the floor and starts, we call it dancing, but she lays on her back and, starts. Yeah. So that I like to think about her, and then, also just like funny things that my kids say, or, even my parents, but, but I guess, I guess that was my funny moment of the day.
I love it. Well, you're getting activity and you're getting socialization from your fur friend.
Yes, and some giggles in there too.
That's right. Laughter is good for the heart and
That's
good
right.
for the brain, good for the soul. So,
Absolutely.
well, Jody, we can't thank you enough, and you will be back on the podcast if you accept our invitation.
I
So
would love
thank
to.
you.
This was fun.
Yeah.
But I want to ask y'all some questions too.
Yeah, we
Well,
should
come
do
on.
it.
We can do it. We can do an opposite direction. You can be our guest host, and we can be the panel. I kind of feel like we're on the Brady Bunch or one of those.
That's right.
Shows, when we're zooming. Well, Jody, again, thank you so much, Jody Gilchrist. She is a wealth of knowledge. I'm so glad you were on today. Everybody, stay heart healthy.
Oh, here, let me get my heart. Here we go.
Yes, everybody, I love your heart. So remember, heart healthy, brain healthy, heart healthy. So please, if you like what you heard, please like, subscribe, follow, share. We are on Apple, Spotify, YouTube. All things great. Jody, we'll have you back again. Thank you so much. So everybody sign off, but please share, follow, like, subscribe, all those things. And until then, thank you.
Bye. Thank
Thank you,
you.
Jody.
Thank you.